Hello everyone, I'm Dr. Annie Varughese, and I'm here to welcome you to the Best Docs Network television show. I'm trained at the Texas Heart Institute, and we want to bring fabulous medicine to our community and to the world. We are featuring some of the best physicians in the Houston area that help to change people's lives. We have a fabulous show for you today. Let's learn more about our first doctor, bariatric surgeon, Dr. Robert Marvin.
We have young people who are already having thickening of their heart muscle. They're already not quite having normal function. And it's the earliest signs that there's a problem there, that the heart's working against a large extra load that it normally wouldn't have to.
When I originally started to even look into this after I talked to my friend, I was probably between 335 and 340. I'd been that for 10 or 15 years, been over 300 pounds for at least 15 or 20 years.
We're giving them back some of that control in that one area where they've had a problem. But it's a dangerous area. I mean, you can't walk around at 310 pounds and think everything's going to be okay for very long. It's not.
There's been times when I'd lost weight before. I've got down to 225 before, but 6 months later, I'm back at 300, and that was always my issue. And after you do that 2 or 3 times, you know, why do you want to do it again? Because you know what's going to happen. I actually had a buddy of mine that did the surgery probably a year before I started looking into it, and he had great results. His weight loss was incredible from what I'd seen, and I'd known the guy for several years. And he was completely happy and excited with everything. So that's when I started looking into the surgery myself.
Buck has lost 115 pounds in about 6 months after having a sleeve gastrectomy. So I mean, that's a good outcome so far. We're only partway through. We're going to expect more weight loss beyond that, although he's clearly getting down towards his ideal body weight, which is where we'd really ideally like to have him.
I started off at 335 or 340 in January.
Because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Colleen had a robotic hysterectomy. She had abnormal bleeding after menopause, and that is always a very worrisome sign if a woman experiences.
My cervix was very thick, and above all my symptoms, and because of my age, you know, I'm 62 years old, so it was time.
Now Colleen was potentially a case of uterine cancer, so I decided to do a robotic hysterectomy on her so that if we needed to, we could continue after the hysterectomy looking for cancer in other places.
I was very impressed with Dr. MTS when I came into her office and her staff. They lined all of my appointments up for me. I just couldn't have been happier with her. I knew as soon as I met her that I was going to be in good hands. She explained everything great.
Robotic hysterectomy I usually do for patients who may have other conditions that preclude them from having a routine laparoscopic hysterectomy. Some of these conditions could be a very large uterus, or if we suspect cancer, or if the patient has had multiple abdominal surgeries and we are suspecting adhesions or scar tissue inside the abdomen, or in patients who are overweight.
When I get up in the morning, I think to myself, I just have so much to look forward to because I don't have that pain, that misery. and I have a lot of ambition right now. I mean, I'm able to do a lot more things, and I'm not constantly thinking about, oh my God, I don't feel good today.
You know, as a gynecologist, as a surgeon, it makes my day when I see a patient get up and walk out shortly after her surgery. I think it's silly to have somebody bedbound for 6 weeks, not be able to walk around, not be able to take care of her household, when the answer is simple. I know that I can get them up and about and moving and back to their life immediately.
In today's Ask the Doctor, Sarah from Kingwood has a question for Dr. Annie. What is high blood pressure?
High blood pressure is a measurement of 140/90 or greater. That means the systolic blood pressure is 140, the diastolic blood pressure, or the bottom number, of 90. Anything above that is high blood pressure. Recently, data has shown that even blood pressure in the 130/80 range can be borderline high blood pressure and should be evaluated and treated. High blood pressure can cause many diseases, including coronary artery disease, can affect the blood flow to the kidneys, can cause kidney failure, can cause stroke, and multiple other problems. So it's an easy thing to treat if it's found. Again, the problem is high blood pressure is not found because it's a silent killer. Check your blood pressure with your doctor. Make sure you have regular checkups, and that can be a great prevention therapy for you with regard to high blood pressure.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
Taking care of the cardiac patient has always been my passion. I trained at the Texas Heart Institute, where we know that we have to be aggressive in saving people's lives. I also love preventive cardiology. I want to tell you the story about Thomas, a man who didn't even know that he had coronary disease and came to my office, proceeded to die on the table, but we were able to save him. Listen to the story and take it to heart. Maybe this will help you or someone that you love and save their life. Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varughese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory, found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and he had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varughese is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
How do you know if you have carpal tunnel syndrome? The carpal tunnel is a little tunnel that a nerve goes through in your wrist. And people who have carpal tunnel syndrome will generally awake in the middle of the night with their hands being numb. Their fingers will tingle. Sometimes that tingling will go up their arms. Now, generally, it goes away when they wake up and they shake their arms, mainly because they're changing the position. When we're asleep, our hands tend to go like this, and that cuts off that carpal tunnel and pinches the little nerve that's in there. It's called the median nerve. That gives you the tingling in your fingers and sometimes up the median nerve into your arm. So one way to prevent it is to sleep with splints or ACE bandages that keep your wrists at a neutral or up position instead of letting them collapse like this. Also, we see a lot of carpal tunnel syndrome in people who have gained a lot of weight because that puts pressure on the inside of that tunnel. Also, there's something about diabetes that affects that nerve. But in general, if you wake up with your fingers tingling at night, it's not your circulation, it's probably your carpal tunnel. Lots of easy ways to fix that, so don't panic, just get it checked.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point. You know exactly what he could do for me, and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
Wow, that was a fabulous story with great information. If you want to have more information on any of the doctors you have seen on today's show, go to our website, bestdocsnetwork.com. Now it's time to head to our next doctor, Dr. Paul Metz, who's an oral surgeon in the Houston area.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
High cholesterol is a major problem in this country as well as in many countries around the world. High cholesterol leads to atherosclerosis, blockage of arteries that affect many organs throughout our bodies. So how can we effectively treat high cholesterol? There are medications, but sometimes medications can cause multiple problems for patients, multiple side effects, muscle pain, weakness, breakdown of muscles, liver dysfunction, to name just a few. So we know that natural has always been the best, and we look for natural therapy with regard to cholesterol reduction. There is something that we use called Bio's Life Slim, which is a fiber product created at Stanford University about 20 years ago to treat high cholesterol in those patients who are intolerant to medications. It's been there for 20 years, but not many people know about it. We use it in our practice, and we've taught many doctors how to use this effectively to lower cholesterol. LDL is lowered by 30%, triglycerides lowered by about 50%. So ask your doctor about Bio's Life Slim. Look for it. It's an amazing therapy, and it will help you to change your life.
Many presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, you know, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think like probably about a year. And so it had got so bad I couldn't even wear a shoe, so that's what really made me came in, you know, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of, you know, surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better, you know, no pain, you know, it just felt better. And I was so happy, you know, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, you know, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump because first it gets red, and next thing you know, you have a wound. And that can be problematic because then you can get an infection to the bone.
I mean, it's not sore or nothing. It just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. You know, a lot of people are concerned that they've heard from their neighbor or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and it keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and you know, we've really come a long way with our surgeries.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s. The average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
To be a comprehensive breast center, it doesn't mean having a nice building and a nice name on the center. There's a lot of people that have done that. What makes you a comprehensive breast center is working with other physician specialties together to do the best that you can possibly do for each patient. It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are. This is what the beauty is of a comprehensive breast center. So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team. When people come to TOPS Comprehensive Breast Center, or if they come to one of our Memorial Hermann Breast Centers, what they'll see is a group of dedicated breast radiologists. So when they come to one of our centers, they're dealing with a radiologist who is focused on finding cancer at the early stage. And one of the things that we talk about as a group, we want to disrupt as few lives as possible while finding cancers at their earliest stage. That's our mission statement. If someone comes in and we have a finding on the mammogram, or they come in with a palpable lump and they need an ultrasound. In many facilities, this is performed by a technologist. The doctor may or may not ever see the patient. If they do see the patient, they only look at the area of interest. It is our policy and our practice that radiologist comes in on every patient. We scan every patient ourselves. Yes, our technologists look, but we scan every patient. My strong belief is, and I think statistics prove that, is that when you have specialists doing this, you get a better result. In our practice, that's what we do. That's the whole focus of our practice. You know, it's a very special group of people from all over the country, from very well-trained facilities, and so it's an exciting group to be part of.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives. For more information for any of the fine doctors that you have seen on today's show, head to our website at bestdocsnetwork.com. If you have a question or a comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. See you next time.